Hey everyone, I'm Anastasia, your host for Anastasia's Hump Day Happenings with a special guest appearance from Gibbs the Husky. All right, this week I am going to answer a question from a viewer. Great question. What can dental patients expect from their dental practices as they reopen? I'm going to share a little bit of my experience with you because of that question. And I know some of you are nervous, and I would be nervous too. You know, I was a senior in college, getting out into dental hygiene. I was just getting licensed as a dental hygienist when the AIDS pandemic happened here. And you can imagine it was 1988, and oh my goodness, it was terrifying. What I was taught with PPE, that was like standard now because there were people that practiced without gloves, if you can even imagine. But I was trained with masks and gloves, and when the AIDS pandemic hit the United States, we then became more aware of the value of disposables. We used disposables, we covered chairs with plastic. The way that we cleaned a room was completely different. So I'm sharing this with you just to say, you know what? I adapted and I protected my patients and myself, and I did it clinically for 25 years. There are a couple of things though now that we have to adapt to and shift again, because basically your dental team, your dental practices, they are also your healthcare heroes. My question for you before we even start this is, has your dental practice kept you in the know? A dental practice can keep you in the know in the following ways. They could place out a video and place it on their social media sites by saying, hey, we're going to reopen and this is our new look. Are they showing you what their, steps that they're taking to clean the rooms, what that will look like? Are they going to take your temperature? Are they doing, a pulse oximeter instead? What to expect basically before and as you arrive, during, and then after. So to make it you more comfortable. So is it on their social media sites? Is it on their websites? Are they emailing you with a newsletter or using a text campaign? This is what I mean by, are they keeping you in the know? So let's get started for what you, the dental patient, can expect or should expect from your dental practice. Number one, pre-screening questions before you get to your dental visit, before you step a foot into the building. So pre-screening questions will be done over the phone. Number two, as soon as you do walk into the dental practice, you should have hand sanitizer, and it's either a forehead thermometer, or they call it a temporal thermometer, or a pulse oximeter for your finger, and that can be taken right away. Now, number three, in a perfect world, you are now immediately taken to a treatment room, okay? Now, but if you're not, it's okay. It doesn't mean the world isn't perfect. It's just, we're all getting used to this. But what that does mean is you will be sitting in the reception room just as you normally would, minus you will be socially distant. So there might be a few other people. I've worked in places where there's a lot of people. No, a few other people. And there will not be dental magazines, there will not be a coffee or tea station, and there will not be toys for the kids. Okay, so that has changed, and everybody will be wearing masks. Number four, treatment. If you're going for the wellness visit with your dental hygienist or the restorative with your dentist, here is what to expect. Number one, your team is going to look different. And again, it's really helpful if teams do this, but prepare kids too, especially. So yes, we're gonna have the PPE, we've got masks. I would also ask this, are they N95 masks? They should be N95 masks. Gloves, clearly. Scrub, like for your hats, like a surgical scrub hat. Face shields. Everyone wears face shields, not just the doctor, the dental hygienist, and the assistant wear face shields. And booties and gowns. Okay, so they're gonna look like a surgical team. This is really important because it's about protecting you. We know it's about aerosol, and we're trying to diminish or reduce the aerosols that come from your mouth, clearly. Also during treatment, your appointment could take longer because it's going to take us longer to clean the room and perform what we need to do, especially the dental hygienist with your wellness visit, and here's why. So you will be likely asked to rinse with a pre-rinse because this diminishes the aerosols in your mouth. The second thing, selective polishing and zero air polishing. When you use the air polisher, clearly it's a lot more aerosol, and that may be diminished. The other thing, hand instrumentation over ultrasonic instrumentation. That's what's gonna take longer. And I know for periodontal disease and periodontal maintenance, ultrasonic is really, that's the integrative therapy. Some practices right now in some states, it's depending, but at least with hand instrumentation, we can start to get somewhere towards the path of health. Now, if you're on the restorative side, to decrease aerosols with the dental handpiece, you may be asked or just know a rubber dam may be placed in your mouth to decrease aerosols and more use of what I've called the Mac Daddy suction or the HBE or an isolate symptom. Or an isolate system. This may replace Mr. Thirsty or the smaller saliva ejector because the HBE sucks everything out right away. Versus the smaller one, we're trying to diminish and decrease or reduce aerosols. All right, number 5, teledentistry may become more common, meaning consults with your dentist, maybe one-on-one versus you hanging around, going into an office, that kind of thing. Some practices will have the dental hygienist perform their wellness visit, and then the doctor may do the exam via teledentistry. So this is possibilities, but you get to ask questions. It's so important that you do. Then this isn't one to expect, but it's one that I would recommend. When your treatment is completed, personally, I would ask, where's the hand sanitizer? And I would replace the mask I came in with onto my face, and then I would walk up to the front to pay for the service that was just rendered at the front desk. We will get through this together. We just have to adapt. You get to be health empowered and finally breathe and smile because you've made one step closer to your health, which is connected, by your smile. Now you've got a question for me, ask it, I'm happy to answer it on a future episode. Otherwise, like this channel and join me every single week. And until next Wednesday, take what you learn and make a difference with it.